Hello everyone, my name is Anja Leist. I am Associate Professor and ERC Fellow at the University of Luxembourg, and I'm presenting on behalf of the consortium of the APPS project L'approche patient partenaire. I'm going to present the patient's perspective on the use of personal health records based on the findings of a questionnaire study in 4 regions of the Greater Region. After discussing the patient's perspective on questions of safety and data protection, I will present socioeconomic and behavioral determinants in the preferences of access to and use of personal health records. From a patient's perspective, personal health records should ideally improve access, delivery, and quality of healthcare services. They empower patients by making all relevant health information accessible so that patients can make informed decisions and be more proactive. The APPS project ran several studies, and I'm going to present here the results from the harmonized questionnaire studies from the 4 cross-border regions. So this was a self-administered questionnaire developed with patients' representatives in each country, but harmonized then across countries, offered in 4 languages. And we recruited participants online, in person, and via various patients, associations, hospitals, and health clinics. A total of 829 people participated in the study. You see here an overview of the status of personal health records in the Greater Region. In France, there's a dossier médical partagé since 2004, but only since 2016, the personal health records have been widely adopted. In Germany, there is exchange via the electronic health record among the health professionals, but patients do not have access to their personal health record yet. This will be mandatory, however, starting January next year. In Belgium, patients have a long-standing right to consult their health record, first in print and then also via the internet. And there's a national portal for patients since 2018. In Luxembourg, the personal health record, which was called Dossier de soins partagés, was piloted in 2015 for chronically ill patients. There's an on-demand access since 2019, and this year everyone in the country received the invitation to access their personal health record, also the caretakers of children. Let's look at the expectations in the use of personal health records. And you can see here agreement with different statements in the APPS questionnaire study. In general, participants were quite aware of the benefits of personal health records in terms of empowerment, information, and improving communication and coordination of healthcare. The only statement receiving less agreement was to involve friends and family in personal care. So this is not a relevant factor in the access of personal health records, and also points to the perceived privacy of health data. Regarding intentions and other expectations, here we have the agreement with different statements in a subsample of respondents who wish to access their personal health record. Again, these participants were confident that their personal health record would be easy to use and that they would benefit from using it. But only a quite small part of the sample intends to use the personal health record on a regular basis. So what about safety considerations? This is the answer to the question, who should have access to the personal health record? And we see that the participants, the patients, made clear distinctions between the different actors and what access they should have to the personal health record. Insurance companies, and to a smaller extent also administrative staff in the healthcare system, should have little or no access to the personal health record. On the other hand, the family doctor apparently enjoys a lot of trust, as most of the participants would give the family doctor full access to their personal health record. What about data protection? Here you see agreement with different statements, and yellow means agreement or strong agreement. We see that in general, about 2/3 of participants feel that European data protection regulation is sufficient to protect their personal health data. However, also over 30% agree or strongly agree that they are hesitant to use their personal health record due to fears that their health data may become public. Now to the socioeconomic determinants. Why is that important? We know from other studies that some populations have physical access to their electronic health portals and their personal health records, but the uptake among certain socioeconomic and ethnic minorities has been rather slow and socially patterned. And we also know that personal health records are used more frequently by those who are already healthier and socioeconomically more advantaged. So in the UPPS study, we also wanted to investigate which sociodemographic and socioeconomic factors determine whether people have access, wish to access, or intend to use the personal health record regularly. And also what behavioral factors linked to the acceptance and use of technology are associated with the intention to regularly use the personal health record. So we looked into having already access to the personal health record, the desire to access the personal health record, and the intention to regularly use the personal health record. We particularly looked into education, income via the perceived comfort, living on present income, and migrant status. And we looked into the factor analytically derived scales of the UTAUT model. We had 3 factors here: the perception that personal health records are useful and easy to use, that people have social support to access personal health records, and that they have no anxiety or they have confidence in accessing the personal health record. And we controlled for different confounders. So as a summary, there's a clear gradient in the desire to access and the physical access to personal health records, with those more educated and living more comfortably on present income, showing a stronger desire to obtain access to their personal health record and a greater intention to use their personal health record regularly. People aged 65 years and older and migrants, particularly those with lower comfort living on present income, reported lower desire to access their personal health record. About 1/3 of those with desire to access intended to use the personal health record regularly. Perceived usefulness and ease of use were the strongest predictors of intention to use the personal health record regularly, followed by social support and lack of anxiety. So, some recommendations from this study. Regional actors, health professionals, policymakers need to take into consideration each stage of the use of personal health records: physical access, desire to use, and intention to regularly use the personal health record. Based on these findings, we suggest that the access to personal health records should be given universally on an opt-out basis.
Jolien, the video was interrupted.
Sorry, I made a mistake. Sorry, I'm just stopping the sharing.
Okay, thanks.
Sorry, I clicked the sharing video. So yes, we are here. Sorry for this.
No problem. I'll go back a few seconds and start again.
You have to put the sound on.
Special attention needs to be paid to those who are not motivated or who do not wish to have access to their personal health record. These are older people, migrants from less advantaged socioeconomic backgrounds, and in generally people from less advantaged socioeconomic backgrounds. And then in a second step, after there's satisfactory uptake of the access of personal health records, then the regional actors should ensure that personal health records are accessed regularly. So, for example, regional actors could send reminders or could regularly ask if information is up to date, for example. And in general, we need to show the benefits and added value of the personal health record and offer encouragement to individuals to obtain access to their records. If this is not done, one may run the risk that already advantaged groups may be the only ones to benefit from the advantages of personal health records. And this may then, contrary to our efforts, exacerbate existing health inequalities. Now, all left is to acknowledge the work of the whole APPS team and the funding by the European Union and the Wallonie. The lead of Ivana Pacou and Etienne Le Bihan in the analysis presented here, the principal investigators of the APPS at the University of Luxembourg, Michel Baumann and Louis Chauvel. And if you have any questions or comments, please feel free to contact me. Thanks.
Thanks a lot, Anja. I don't know if you have some questions. Don't hesitate to put it on the chat or on the Discord channel. I had otherwise some questions. So what is the experience of the patient to the access of their data?
You mean how long it took them, or
yeah,
what
but
they
also
needed to know?
what's their experience? As I presume it depends also if they have an easy access and knowledge of IT and so on.
Yes, so we probably have a strong selection of those people accessing their health record who already use the computer daily, or at least have some knowledgeable children or grandchildren to do that. In Luxembourg, you get the information by mail. So basically, all is left is to go to the computer and type in the code that you are sent. In Belgium, we had quite a small part of the sample already having access to their personal health record. So I think, yeah, the more barriers are put between having the wish to access the personal health record, which most participants had, and actually being able to access it due to the need, for example, for a code or a password, the fewer people will really go into their health record.
Mm-hmm. So the problem is also the patient should be should know that the patient's health record exists and that they have access to it.
Yes, and we see in other studies related to health apps, for example, that some parts of the population don't consider this information relevant to them. So I think higher educated people will just basically know how important it is to look if, for example, the health data are right, or if they consider all diseases, or yeah, so they have some health literacy pointing to them the importance of personal health records. But I don't think that everyone has this knowledge. So there needs to be much more raising of awareness, for example, now in these early stages.
Mm-hmm. And we know in Belgium it exists, but it's not always with the whole information, all the complete information. You have, for example, only the vaccinations, but not the rest. And it's not always easy to access it. So it's not because it exists that it's used correctly also.
Yeah. So at least in the piloting stage, I can now speak a bit better for Luxembourg because I know the process best. In the piloting stage, that was very limited what you could do, and only people on statins, for example, received access at first, and other chronically ill patients or people who chose their primary physician. But at least in Luxembourg, there should be now a possibility to upload own information and to annotate, at least put in notes. Of course, not change health information that has been put in by the doctors. That would also be dangerous, right? But at least complete the file a little bit from the patient's perspective.
Yeah, and in your project, do you have recommendations on what regions should do to make the data accessible for the patients?
I'm not sure what you mean.
We know that some patient health records exist, but the people or the patients are not aware of it.
Okay.
And so what are your recommendations to have the people using it and actively using it?
So I would say the classic tools of raising awareness. So have something in the print media, have something in television, a report on what personal health records are and that everyone can use them. Putting in flyers in the clinics and in the doctor's offices. Yeah, so basically showing people first this exists.
Yeah. And you had really different experiences in the different regions in your project?
So Germany stood out a bit, of course, because there is no access yet. And I know from the discussions over the last, I think it's more than 10 years of the elektronische Gesundheitskarte, that it's not, it wasn't made easy for the patients to access the data. And at first you needed to agree that health professionals have access to your data, which is something else, right, than accessing it yourself and then also giving permission to others. So the Germans in the sample were a bit more hesitant, but in general, I have to say most people would want access, but they were not always aware that in 3 of the 4 regions we looked at, there was already access.
Yeah. Well, thanks a lot, Anja. So there are still some